Hi, I am delighted to join you today to talk about cybersecurity. I will start by saying, I guess I should introduce myself. Again, Carrie Cochran McLean. I'm the Chief Policy Officer here at the National Rural Health Association. And I am in no way a cybersecurity expert, but I do work on a lot of the issues here in Washington as we try to address the challenges that rural hospitals are facing when dealing with cybersecurity and cyber hacks and the impacts it's having on all of you day to day. So I'm going to do my best to talk about what I know in terms of resources and activities that are happening at the national level that may be available to you. This can be interactive. I can't see you real well, so just chime in, speak up if you have questions. I think if you raise your hand, you'll show up on my sidebar, but feel free to interrupt me. I've got two tween teen kids, so I am used to being interrupted on a daily basis, and I would really love for this to be interactive. I think all of you should know NRHA, but just in case you don't, we are the national voice for rural health, and we do our work through leadership in advocacy, communications, education, and research. So my job is the advocacy arm of the organization, working with members of Congress, members of the administration, and all of you as advocates to change policy here in DC at the national level. So cybersecurity, we know that this is a growing issue, a significant issue for folks, honestly, across the board, not just in healthcare, but we know that the implications for operations in healthcare are significant and unique, and especially when we talk about the rural setting. So, in between 2022 and 2023, healthcare cyber attacks, so across the board, not just specific to rural, rose 128%. And we know that number has jumped even further, especially after the change cyber attacks. I read a statistic saying in the month after the change attacks, there was a 40% increase just in that month in terms of people doing cyber activity against healthcare facilities. So this is a growing area, not of concern for healthcare facilities. And rural is an increasing target, and that is for a lot of reasons. The medical records that rural facilities have, that healthcare facilities have a high value on the black market. You all know, especially if you've been part of one of these incidents, that there's a high cost both to deal with the cyber hacker or the cyber terrorist, but also to deal with the implications that has on the operations of your facility. And I'll talk a little bit about some of the resources coming out of the federal government, but let's be honest, they are confusing, they are conflicting, there are a lot of parties involved, just at the national level. And then I assume I have limited knowledge, but I have some knowledge of what's happening at state levels as others are trying to get involved and help. And so we know that as in a lot of areas within rural healthcare, those challenges we have in terms of our limitations with resources and infrastructure and workforce, that all adds kind of another layer of how we're dealing and able to address cybersecurity. So we have I think there's some interesting let me back up. So the Journal of Rural Health recently put out an article. I think it was just a couple months ago. I can send you all the link. It's actually in the notes of the PowerPoint that Rachel has. And the link is there on the website. That talked about, it looked at a specific kind of set of cyber attacks that happened, ransomware attacks that happened, and compared kind of what operations looked like and the disruption of operations in hospitals in rural and urban areas, and kind of what was the magnitude of that, and what did it mean for the facilities themselves. And you can imagine, as you can imagine, the impact of what occurred was similar in terms of the magnitude of the disruption. they were closed for a period of time. Their volumes changed. They had to, kind of maybe use some paper charts. That kind of thing happened in both types of facilities. But the impact and the magnitude of that impact was much greater on rural. And we all know the reasons for that. One is because of the distance to alternatives for care, for the patients seen by the facilities. And then the other is kind of the outsized impact of the loss of revenue on rural hospital finances. 50% of rural hospitals at this point operate on negative margins. So going a week, going 2 weeks without those kind of outpatient visits that you're used to having can have a real significant impact on your overall bottom line. I'm preaching to the choir. I know that. Just a little bit, you can see, I don't have to go through the weeds of this, but you can see kind of the specifics around the Medicare claims data when they did this analysis. The inpatient volumes were, again, kind of similar in terms of decrease, but the outpatient visits are really where the rural facilities got hammered. And then you can see that the travel time and distance to closest alternatives was obviously greater too. So there are some really specific impacts on rural that we need to address. So last year, 2023, NRHA released a policy paper specifically calling out the issues that rural is facing when it comes to cybersecurity. And we're asking federal policymakers, federal and state policymakers, to do things like establish regional cybersecurity support centers for our providers, really think about how we're strengthening cybersecurity education and training. Obviously, for those individuals in our facilities that are providing the technical capacity, but honestly, for our clinical staff, for our administration staff, for our boards, so they understand kind of the impact of what's happening when and if we are impacted by one of these attacks. We're asking for collaboration and information sharing. So when these incidents do occur, there's lessons that can be learned and we can figure out a way around some of this. First and foremost, and this should actually be at the top of the list, is increased funding and resource capacity to be able to handle and prevent when these things do happen. And then, believe it or not, we're still having the conversations about broadband. And it's broadband. I would say it's also, and again, I am not an IT person, so I am going to bumble through this, and apologies for anyone who this is painful to who is an IT person who has to hear me talk like this, but it's the ability for our systems to operate at the levels they need to be safe. I talk to hospital administrators all the time that have equipment that is outdated and doesn't meet the security standards that we need to have, whether that's imaging equipment or it kind of everything at this point is connects to the internet, and all of those connections need to be secure. So there are just so many facets of this that, in addition to kind of your ability for your baseline connectivity, there's thinking about the security of all of those things that do connect. So you can find a link to our paper. It's got some background on the issue, and then again, the specific recommendations we have as an association at that link. And that's played out really in a couple different areas that we've focused on in the last year. They really are around trying to work with the many federal players in this space to encourage them to align standards, requirements, whatever they're going to do, to make it easier and consistent for providers to be able to understand what they need to put in place and how they need to handle and respond to situations when they do occur. And there are a lot of players in this space. The next slide I have is going to talk about, it gives links to some resources in each of those, mainly in the health space. But we're talking about kind of guidance that's required from Health and Human Services, Homeland Security, Justice, Education, Treasury, and Commerce. So you all know how well, and I say this as a former bureaucrat, you know how well the federal government talks to each other, talks to itself. trying to align all of these pieces is challenging, and that's been a big focus. Is really, and we have actually Brock Slayback of NRHA is sitting on one of these committees, operated to specifically look at how we're working with rural healthcare providers and really getting some of those standards and supports and practices in place. So that's been one of our big areas of focus. Another is really to ask around, to ask for funding and support to enhance both prevention and response for rural providers. So that's technical assistance, that's training, that's just flat out dollars for capital, or capital for improving equipment, improving software, improving breach support. And one example of that is within the Flex program, we have asked for a bump in the small hospital improvement program, the SHIP line, for additional money specifically for cybersecurity. That's the program. The SHIP program is the program that puts out dollars to every small rural hospital in the country. We're asking for a bump in funding there to give money out specifically for cybersecurity. And we did see a bump in that line in the FY25 proposal coming out of the House. So we are hopeful that there'll be a little bit of a bump there for rural hospitals in the coming year. So it's nibbling around the edges, but trying to get more resources out to rural providers to be able to prepare and respond to these situations. And then to really think again about the IT workforce development. We had a wonderful conversation with a bunch of rural hospital CEOs in June, and we were sitting around talking about how in so many of our rural hospitals, our IT guy is not, I mean, God love them. It's not necessarily someone who has kind of gotten every level of cybersecurity training that we need in our facilities. And so really having to think about how do we encourage partnerships with community colleges and technical schools, and really making those kind of resources available to our current staff to be able to enhance and stay up to date on the kind of most pressing, breaking kind of issues that are coming at us. And then there are a couple of different bills that we've been working on to get resources out to you all to kind of help move along some of these kind of priorities I've been talking about. The Rural Hospital Cybersecurity Enhancement Act is one of those that would specifically help to develop a work plan on that workforce issue, and partnerships and resources again for those educational trainings. So that's again kind of where we as an association have really been focused in terms of getting you all some additional support. I'm going to talk in a minute about kind of the work we've been doing with Google and Microsoft, which is in alignment with this, but I wanted to kind of give you a more full picture of kind of the various efforts in development. And then just so you have a sense of the federal resources that are out there, there are a lot. These are, and I know links can be kind of overwhelming, but these are probably the 4 areas that I have used the most, that I recommend as kind of some good go-tos. The HHS Healthcare and Public Health Cybersecurity Gateway is probably the one there on the top, is probably the best place to start. It has resources that can really help your facility think holistically about how to be what they call cyber resilient. So it's got best practice guides, it's got educational materials, it's got some threat specific intelligence, and ways to kind of stay up to date on the most pertinent or most kind of emerging cybersecurity resources in kind of the healthcare sector. The HHS Office of Civil Rights Cybersecurity Guidance has resources specific to what you as a HIPAA covered entity needs to do in terms of your federal requirements. And there are requirements there. I made a joke that the director of this office did not appreciate at our Policy Institute about how nobody ever likes to admit that they've been, when they've been breached. But unfortunately, you do have to admit it. There are notification requirements. There are things you need to do to stay in legal compliance, and that website is a great place to get some of that background information. The HHS Office of the National Coordinator for HIT is another kind of good central repository of all sorts of tools. Again, they've got some templates on there, they've got trainings. So another place if you're looking for something specific. And then CISA, which is the group that Brock Slayback is working with, that is out of, I think, either Justice or Defense, I can never remember, has a specific project that's on rural emergency medical communications. It's a demonstration that's looking at how to leverage existing technologies to help kind of establish medical communication systems and working within kind of the infrastructure in the rural healthcare system. I don't really know a lot about that, but just know that there are kind of, in addition to these resources that are out there, there are kind of models that are trying to figure out the best way to protect and address some of it. Brock could probably tell you more if you're dying to learn more about that demo. So the reason why we're all here today, back in June, I think it was, recognizing kind of the critical role that rural hospitals play and the unique challenges that our facilities face in our communities. The White House worked with NRHA, the American Hospital Association, Microsoft, and Google to really think about what could be offered in a public-private partnership to address some of the rural cybersecurity challenges. And I think this is a good start to the conversation. More definitely needs to be done, but it's really important to think about, or I think it's really encouraging to see players like Google and Microsoft recognizing the challenges we face in a rural market. And this is really the beginning of hopefully an ongoing effort. You'll see as I go through the material, some of this we know now, some of this you'll see on their website. And as I'm talking, they talk about more to come. So we have seen a fair amount of interest from our membership on a number of these offerings. Happy to share them with you today. And as we learn more, I'll be sure to share that with Rachel. And again, hoping that this is kind of an ongoing learning and resource for everybody. So starting in the Microsoft space, they kind of broke up their Microsoft cybersecurity program for rural hospitals into 3 sections. The first is around affordable access. So they are offering grants and discounts up to 75% on Microsoft security products for critical access hospitals and rural emergency hospitals if they are not owned by, managed by, or affiliated with a hospital system. And that is a big if. We have heard from folks who have been denied from the program because they have some kind of affiliation. So you truly do have to be an independent facility to participate in that. They also are offering access to their security, their software. So they have an advanced security suite at no additional cost for 1 year for larger rural hospitals. So you don't have to be a CAH or an REH if you're already using Microsoft solutions. And then they have an update for those that are using Windows 10 And again, that's a 1 year update at no cost. So this to me is getting kind of facilities that may not have access, smaller facilities that may not have access to security products. And for those that do, it's trying to make sure that you can maintain that access for a year at no cost or enhance that access depending on kind of what your situation is. The second space is around cybersecurity capacity. So they are offering two kind of free assessments. The first is a free security assessment that will help you evaluate risks within your hospital IT environment. And then based on that assessment, they'll help you identify an action plan to better protect your facility. And they are using kind of within that, as you can imagine, kind of the health sector best practices and goals for healthcare cybersecurity. And the second assessment is using cybersecurity awareness and I'm sorry, the next piece of this is a free cybersecurity awareness and risk mitigation training for your healthcare frontline and IT staff. So that's some training capacity, again, both awareness and risk mitigation. What are those things you need to avoid? I know a lot of us already offer something like that to folks in our facilities, but another lens maybe to look at it, and it is free. So another offering that we could consider. The other piece that I have not yet heard detail on, but I'm very curious and hoping we find out more soon, is the launch of a new rural health AI innovation lab. And so with this, Microsoft is looking for a cohort of rural hospital leaders who are interested in bringing AI solutions to the market that are really relevant for rural hospitals and for the kinds of settings and services that we are offering in our rural communities. I honestly don't know more than that. But man, as we talk about kind of AI, I don't know how you all feel about it. Some folks get really excited about it. Some folks kind of sigh and roll their eyes. I tend to be somewhere in the middle. But it is one of those things that I would love to see rural be involved early on in the conversation so that we don't get all the way down kind of down the road and be in a situation where rural once again is kind of not considered as the AI kind of platforms, and however it's going to be used in healthcare is not considering our environment. So this is a neat idea, but as far as I know, no one has been selected to participate yet. So there's still a lot of opportunity there. Eligibility to participate in the program, they are defining rural using the Federal Office of Rural Health Policy. So that is, just as a reminder, it's the OMB definition of non-metro counties, or if you are in a metro county, if you meet RUCA codes 5, 4, or higher. They have a couple of exceptions here or there. But the FORP definition is your definition to go to. And again, that link is active and you can find out on that website if you're eligible. If you're an urban facility, you are not eligible. And again, depending on if you are looking at that first as a CH, if you're looking at that first program, if you're affiliated with a system, you may not be eligible. So just things to keep in mind. And it seems like a pretty easy process. I've heard from folks that it hasn't been too painful. You go to the link there on the slide, and you submit that information. And below that, if you were on the website, below that, those drop boxes, there's a submit request. That's the only information you need, and they'll get in touch with you about next steps. So that's the Microsoft one. The Google one has much less information out about it, and I honestly don't know if anyone has successfully engaged yet. But we have heard directly from Google a couple times, so I know that they are interested. They have a couple of different elements to their program that they are outlining for us. One, they like to reiterate that as they develop their technologies, they are always offering secure technologies, and their technologies always support kind of critical information sharing. And then other pieces, and I'll get into the weeds of the specific products being offered, but just to use their terminology, they are as part of their program, they are offering endpoint security advice to rural hospitals and rural nonprofit organizations at no cost. They can, those organizations can also get discounted pricing for communication and collaboration tools and security tools. And then they also are doing a pilot program with rural hospitals around developing kind of security capabilities to meet rural facility needs. So, what does that all mean? If you're like me, I'm like, that's nice. I have no idea what any of that means. I'm not entirely sure, I will be honest with you, but this is what I could figure out, and this is what I've understood in talking to them. So, what that means is that they are offering their Chrome Enterprise browser and Chrome OS as a modality for facilities to use internet and internet technology to operate facilities. So this could be like your browser. They are offering kind of the Google Workspace as an alternative to the Microsoft platform workspace, like Windows 10. You could use the Google Workspace. They're offering you the Enterprise Essentials Plus. It is HIPAA compliant, and it does have productivity, like all of the different Word, Excel, etc. It has messaging like email. It's got identity and data security platforms all built into it. So they are offering that to rural facilities for free. They also, and I was a little unclear, and I haven't been able to get specifics from people, but another thing that they are offering is funding to support training of cybersecurity professionals. I think it is, they said that they're supporting cybersecurity clinics at universities and colleges. So I think what they're doing is simulation work, but it was a little bit unclear to me. They've already started funding some of these, and they've listed some of them on their website where you can go and find more information. So there may be someone, I didn't see anybody in Missouri off the top of my head, but that may be a good place to do some recruiting, or there may be someone near you that you could kind of check out, TBD. And then another thing that they are making available to folks is they have this Mandiant Academy, which is their kind of online training, online learning platform. And they have a number of different courses that may be of interest to your IT people. I don't know if any of you are IT people. If so, this language may make more sense to you. But they have things like Health ISAC, AIM for Health ISAC. They've got Threat Space, Digital for Forensic and Incident Response Bootcamp. So they've got some kind of good trainings that your folks might want to use and take advantage of in that space too. Their application process is a little bit more, I could say direct, I could say unclear, but you just email them at rural-health@google.com to participate in any of these different product offerings. And then when asked about kind of that program that they mentioned here, the pilot program with rural hospitals around kind of secure capabilities within our facilities. I think that's still in development, was what I was told. So more to come there. Maybe clear as mud.